Okay, so part 2 of chapter 6 of the integumentary system. We are picking up on skin carcinomas. We just finished talking about benign and pre-malignant growths. So with skin carcinomas, there are 3 types. There's basal cell carcinoma, squamous cell carcinoma, and malignant melanoma. We're going to talk about basal cell and squamous cell on this slide. So basal cell carcinomas, these are all cancers, okay? OMA always refers to cancer. These are the most common type. They are in the deepest layer of the skin, so like the basal layer and the hypodermis. Squamous cell, these happen at the epithelial level, so more superficial. Symptoms, these tend to show up on sites that are sun exposed, so, excessive sunbathing or tanning beds or just frequent sunburns as a child. They can show up in many different ways. They can be a shiny bump, something pearly white, or a sore that keeps getting ulcerations over and over again, like a cycle of ulcering and healing. It could be a smooth growth with an indented center. This is why it's important to get checked by a dermatologist, because they are trained to be able to identify these cancers that other people might not be able to. So the cause with squamous cell carcinoma, SCC, these are usually formed from like recent sun exposure. So like an older person who has just been recently using tanning beds, versus basal cell carcinoma. This is usually result from like excessive childhood sun exposures, like those kids that never want to wear sunscreen and always get sunburned. Basically what happens is that the UV rays from the sun damages the DNA of the skin and also damages the skin's immune system. So the skin's immune system generally will be able to help fight off some of those tumor cells, but the UV rays damage the ability to even fight back. Risk factors for developing either squamous cell or basal cell carcinoma is light skin, light hair, light eyes. So like Caucasians with blonde hair and blue eyes are extremely at risk. Diagnosis is usually visual to start with, and then a biopsy to confirm. So they take a few cells, a scraping off of the lesion to see if it is indeed cancer or no. Treatment-wise, there is this special kind of surgery called Mohs surgery. I've actually seen this. I've seen it done. I did an internship with a dermatologist once. Basically, what it is they will cut out the area that is the little growth, then they will look at it under the microscope to make sure that they got all of it, right? So like in order for them to know they got all of it, there needs to be like healthy skin surrounding all sides of the growth, right? If like at 2 o'clock, if the sore was a circle and at like 2 o'clock there's like still some tumor growth, and then they know it's probably still extending over this direction. So they'll keep cutting and cutting until they get what they call clear margins, or basically until all they have is healthy tissue. Then they know they've got all the cancer out. And you'd be surprised, because you'd think that like what's visible on the surface of the skin often is just like the tip of the iceberg. And there's usually more cancer that's burrowed deeper underneath and spreading out kind of like a web. So the amount that you have to cut out usually is much more than the growth that you can see on the surface. Cryosurgery is just a freezing off of a growth. Electrodesiccation is like burning it, or using a what's it called, I forget the word. It's like they take a fire to it to kind of like burn it. I don't remember what it's called, sorry. But yeah, basically it's just a burning off of the growth using a special tool that emits a burst of heat to singe off the skin cells. Curettage is just to cut it out, and then the radiation therapy as well. Generally, it's pretty curable if you catch it early, before it like spreads super deep into the skin. Here's a picture of what basal cell might look like and what squamous cell carcinoma might look like. Now we are at malignant melanoma. This one is the most severe type of skin cancer, most aggressive. There's the ABCDs of melanoma, which helps to identify the symptoms of what a melanoma growth might look like. So A stands for asymmetry. So usually cancerous growths are asymmetrical versus like benign, like a mole, for example, are usually just round and look the same on both sides. B stands for border. So is the border irregular or is it regular? C is for color. Usually cancerous ones will have more than one color going on, like yellow and red or blue versus like a brown a mole that's just all brown. One color is generally benign. D is diameter, so is it growing in size or is it, staying the same? How big is it around? The bigger it is, usually the worse. And then E stands for evolving. So like, is it changing over time? Like I've had a mole since I was a child, and like one of the ways to tell if something is turning into cancer is if it starts to change, right? If it stays the same and nothing ever, is different, then that's good. But if like this thing looks bigger than it used to be, or oh, it's changing color, those are all bad signs. Causes for this, risk factors include, like we talked about before, sensitive skin type, so pale hair, pale eyes, pale skin. History of severe sunburn, if you live closer to the equator where the sun's stronger, or using tanning beds. Diagnosis is going to be with a biopsy and using imaging like a CT scan to see if there's any metastases or anything spreading to other parts of the body. The treatment is that complete excision with wide margins, which is what I talked about already with the Mohs surgery here. That's the excision with the wide margins. Chemotherapy and immunotherapy. Immunotherapy is just injecting like immune cells to help boost someone else's immune system so that they can fight the cancer better. Also generally pretty treatable, 90% survival rate. This is the ABCDs that I was talking about before. So asymmetry, border, color, and diameter, and pictures of what melanoma might look like. Okay, so now this is another category. There are certain conditions called abnormal pigmentations, and then these are the disorders that fall into that category. So albinism, vitiligo, melasma, hemangiomas, nevi, pityriasis, and abnormal suntan. So all of these conditions involve the melanocytes in some way. The melanocytes are the cells that produce melanin for pigmentation. So with albinism, this disease results in the melanocytes just being unable to produce melanin in general. Like they're just not able to produce it at all. So, your hair and your skin color and your eye color all depend on melanin, like the pigment. So people with albinism, they have white hair and either pink or blue, very pale blue eyes. So you can actually see this girl. This is a real picture of a girl. She has a interesting combination of albinism and, what's it called? When you have two different color eyes. Homochrotoma, something like that. Hemochrotoma, something like that, where it's like you have two different eye colors. It's also common in like those Australian shepherd dogs where they have like a blue eye and a brown eye. But so she has one pink eye. It might look brown in the video, but this is actually pink, and a very pale blue eye, and white hair and very pale skin, and even white eyebrows and eyelashes. Unfortunately, with albinism, people are likely to also have eye disorders because the pigment in the eyes actually helps protect it against the sun. So people with paler eyes tend to be more prone to damage from the sun because the pigment isn't there to protect them from the sun. It's kind of like built-in sunglasses with more pigment. And we talked about all these different conditions when we did the eye and ear chapter, the sensory chapter. So myopia, hyperopia, stigmatism, nystagmus, strabismus, and photophobia. Photophobia is what I was mentioning about like the sun sensitivity, just because of the lack of pigmentation to help protect. All right, vitiligo is pretty common. Most people have seen this before. This is where there's just pale, irregular patches of skin. So like areas of the pigment start to like fade. It affects all races, so black people, white people, the same. It can happen on any area of the body. Typically tends to follow a stressful event, so like you'll start noticing that bigger patches are developing because of stress. So it could be related to something autoimmune. Maybe the antibodies are attacking the melanocytes of the body and causing them to stop working in those areas. So you can see with a darker skinned individual, it's going to be more of a difference, whereas a lighter skinned individual is going to be less noticeable just because they don't have as much pigment to begin with. Now melasma is kind of the opposite of vitiligo, where vitiligo is a pale patch. Melasma is the opposite, so it's like a darker patch that occurs. So like the melanocytes are overproducing melanin on these patches. So it occurs on the face. It occurs in women generally in response to hormonal changes. So pregnancy is a big one. It's very common to happen in pregnancy and if you're taking oral contraceptives. So as long as the hormones are there, the melasma will remain the same, but generally it goes away after pregnancy or after someone discontinues taking oral contraceptives. Okay, so hemangioma, there are 3 different types. There's cherry hemangioma, strawberry, and port wine stain. Basically what's happening here is that there is a proliferation, which just means an overabundance of blood vessels collecting in one area. So there's like a bunch of red blood, which makes the red color. So here, a picture of the 3 different types. This one is a port wine stain. It literally looks like someone spilled a glass of wine on someone's face. This one is a strawberry angioma because it's bigger and it looks like maybe someone just stuck a strawberry on someone's face. And this one's very tiny, like sometimes can be flat, sometimes can be a little bit raised. That one's the cherry angioma, hemangioma. And again, it's just the presence of extra blood vessels. Nevi is just the medical term for moles, just a dark area of skin, which is a very condensed area of melanocytes. So like a bunch of melanocytes in that area producing a bunch of melanin in a very localized spot. Pityriasis, this is actually caused by a fungal infection. The fungal infection actually affects the color of the skin. So it causes patches, it can be either dark or light skin to appear. And it's usually on the trunk, so like on the abdomen and the chest and the back. And the fungal infection tends to cause permanent color change. So even after the fungal infection goes away, it's like permanently affected the melanocytes in that area, causing either permanent darkness or lightness of that skin. Now we've got abnormal suntan. This is just either some drugs or a disease of some kind is affecting how the melanocytes function. So the reason why it's called abnormal is because this happens without the effect of the sun, right? So someone could stay indoors and never go outside and never be exposed to the sun. And if they're taking a certain drug or they have a certain disease, they can still develop a tan from the melanocytes being affected in some way, producing more melanin. And Addison's disease is an example of that. We talked about that in chapter 4 of the endocrine system, where bronzing of the skin is a common side effect or symptom of Addison's disease. So this is a lady with Addison's disease. It's the same lady. You can see that she's a lot paler here and she's a lot darker bronze in that picture, and that's a result of her Addison's. Okay, so now we're in alopecia, which is just the medical term for baldness. Basically just losing hair in the scalp. There are 2 types. There's alopecia areata and androgenic alopecia. So alopecia areata is basically when you start losing hair in patches and like random spots like that. Whereas androgenic alopecia is what they call male patterned baldness. And this one is like the typical, like they start having the receding hairline over here and then they start losing like that spot in the middle of the back of their head, and then they just lose all the hair to where they only have hair like on the sides. That's very typical textbook male pattern baldness. Various things can cause this. Aging can be hereditary. It could also be a sign of different issues. So someone could be losing hair because of a thyroid issue, or someone could be losing hair due to anemia. So it's good to still like check those things rather than just assume, oh, well, you know, you're just getting older, you're losing your hair. You could be having hypothyroidism, and that's why your hair is falling out. Or you can be anemic, and that's why your hair is falling out. For women, a common time for women to lose their hair is postpartum. Generally about 3 months postpartum, your hormones like all plummet, and then that causes your hair to fall out. But you know, it does come back. So that's usually a temporary thing. For men, for the androgenic alopecia, the male pattern baldness, minoxidil is a really great medication that can help the hair to regrow and to not fall out. Unfortunately, you have to constantly take it. Like as soon as you stop taking it, you'll start losing your hair again. So it's not like you just take it for a month and it's better. Like you have to take it like indefinitely. The other thing you can do is get hair transplants. So I've seen people where, like, let's say they have a receding hairline, like right up here, and they want to put more hair up there. They can take hair from the bottom, you know, the hair follicles that are still healthy down here, and then move those up to here so that they can start getting to start like reduce the effects of that receding hairline. I've seen I know actually some men that have done that, and they seem happy with it, so it seems to work for them. Okay, so verrucae is just the medical word for warts. These are caused by HPV infection. Most people, when they think of HPV, they think of like the genital warts, or HPV in regards to like the sexually transmitted disease, but it's just a virus. It stands for the human papillomavirus. It can also affect like the hands, right? So these are warts. They're small, hard, pinkish white, cauliflower-like. Hands and feet, the most common. They are spread by contact because it is a virus. It is contagious. Genital warts are considered an STD. They can be removed with some like topical medications that eat away at the warts. You can have them cut off. You can do cryosurgery, which is freezing them off, or they can be like burned off with electric desiccation. All right, folliculitis. Folliculitis is an inflammation of the hair follicle. So usually these are going to be on like the thighs and the buttocks. I think this is generally because people tend to sit, right? And it like the pressure and the irritation constantly rubbing on them causes that. And people have hair on their legs and hair in like the pubic area, so like it's a common area that there is hair. The pustules form around the hair follicles and then they get inflamed. So here's kind of a picture of what it looks like. The redness on the left and then the pustules on the right. So this on the right is more of a picture of like when they get infected with bacteria, versus the one on the left where it's just red is just more just like irritation. So etiology, bacterial infection by Staph aureus, so staph infection. The bacteria can enter through the skin, through the hair follicle opening. A lot of men get this when they shave, like their beard. So using a razor tends to make it worse because they make like microscopic little cuts in the skin, and the bacteria just like get in there and go haywire. So the beard is another common place for this. Diagnosis is just visualization as well. Treatment, you can use a topical antiseptic. An antiseptic is something that like kills off, prevents the growth of various bacteria. If it's really bad, you can take oral antibiotics to treat the pustules there. All right, and here we are at the end, ending on a scary note. This one terrifies me in my dreams. This one is called necrotizing fasciitis. This is a deadly infection of, this is supposed to say flesh-eating bacteria, not fleshing bacteria. Sorry, typo. But yes, no, this bacteria literally eat you alive. Before I show you a picture, just be warned that it is rather disturbing. So this is a picture of what it looks like. Literally, the bacteria is eating your skin as food. Very red and swollen, severe pain, blisters, ulcers, purulent drainage, fever. The most common bacteria of this is a form of Streptococcus, the flesh-eating type variety. Diagnosis is going to be a culture, to see what grows, to see what antibiotics need to be used. This obviously needs to be treated with aggressive antibiotics. IV, these people are going to be hospitalized. It's so deadly that even with treatment, 1/3 of people will still die. So that's how serious it is, to not let it get so widespread that it covers all the body, to treat it early. But on that note, we have finished chapter 6 of the integumentary system. Please email me with any questions that you may have.